from the clinical point of view, one of the proposals is to use a combination of the evaluation of upper limb function with the 9-ULPAC test, lower limb function with the time spent to walk a given distance, and then the cognitive assessment using the PASAT test. So these are the three that used together may in some way help us to detect a change over time. Usually when we have more than 20% change in one or more of these parameters, we may consider this as an evidence of an increase of the disability and as a consequence of a poor response to the treatment. From the instrumental point of view, the tools that we may use are, as always, brain magnetic resonance imaging is in front. And here, of course, the measures are mostly measures of atrophy, because we know that when the patient enters the progressive phase of the disease, the new lesions are extremely rare to occur. So we need something that is able to measure the global damage. So brain atrophy, spinal cord atrophy, particularly cervical spinal cord atrophy, seems to be quite promising. There are also other proposals. However, to be used on the individual basis, I think these are the only possibilities, even if because of the annual change of atrophy, brain atrophy or spinal cord atrophy is in any case quite modest and more or less of the same magnitude of the reproducibility of the technique. The use of these MRI measures are in the individual persons with MS are still a lot debated, and also in the clinical practice, we should consider that the patient might have MRI tests done with different machines, and then the reproducibility is also lower. So this is still, of course, a problem. A second tool that is now tested is the optical coherence tomography. Optical coherence tomography is evaluating the optic nerve indirectly, because they look at the technique look at the degeneration of nerve fibers of the optic nerve in the retina. And the rationale here is that the optic nerve is a piece of the brain that is extracted from the brain and enters the orbit. So you really look at the brain itself in some way. You look at a sample of the brain in some way. So there are some evidences that there is a good correlation between what happened inside the brain and what happened in the optic nerve in the retina, more specifically, so that this could be a good tool. But again, here the advantage is that the test is very precise, so there is a very little test variability. But again, on individual basis, the level of the change is again more or less at the same level of the technical variability. Then the third instrument the third instrument is coming from the body fluids analysis, and are the neurofilaments are filaments that are present in the blood, that are the core structure of the nerve fibers, because when we have a degeneration of the nerve fibers, we see this type of consequences in the blood and in the spinal fluid, but in the spinal fluid, it is difficult to repeat monthly or yearly the test. In the blood, that's much easier. And there are a lot of data that indicates that there is a good correlation between ongoing destruction on the central nervous system and levels of neurofilaments in the blood. So these are the three more frequently used type of tests to assess the treatment response. Here we have to think there is another major problem, because both the treatment that we are using now for progressive MS are mostly anti-inflammatory treatments. So the way to estimate if they are effective or not should be more in terms of markers of inflammation. However, both these type of treatments have also some effects on the mechanism of neurodegeneration, with very different type of approaches. So for this reason, we can expect that what I just mentioned as a new potential tools may be of some value also in clinical practice.